Career Paths. Elder Care. Book 1. Unit 1. Elder Care. Exercise 5. Page 5.
Health Today. The need for elder care. As medical technology improves, people are living longer. However, most families can't afford to take care of their elderly parents. Therefore, people need help caring for their aging family members. That being the case, our country needs more elder care providers. Actually, we need more skilled caregivers. These individuals are trained in geriatric care. They must understand the needs of senior citizens, and they must understand and provide non-medical care too. Some senior citizens are depressed after they retire. Some of them are widowed. Consequently, we need caregivers to improve the lives of our senior citizens.
Unit 2. Facilities and Locations. Exercise 5. Page 7.
Family Generations Magazine. Advice Column.
My mother lives with my family, but we're too busy to care for her. I think it's time to find her a nursing home. What options do we have? Betsy S.
Betsy, there are many options for your mother's new residence. She could stay with you and sign up for home care. There are several age-in-place options in your area. If she has medical concerns, an intermediate care facility or skilled nursing facility is a better choice. If she's pretty healthy, a retirement home or assisted living facility could work. Also, continuing care communities are good for people who experience increased isolation. They are usually near hospitals in case of emergency. I hope that helps.
Unit 3. Levels of Care. Exercise 5. Page 9.
Lifecare.com. Service for all. At Lifecare, we offer services to meet your family's needs. We offer skilled care and social care in your home or at our facilities. Our nursing home staff members are trained long-term care professionals. Lifecare also has great personal care assistance. If your loved one wants to remain somewhat independent, this is a good option. Our assistants can aid you in almost any task. Assistant visits can last 1 through 5 hours and can occur 1 through 5 times a week. We have 2 wonderful hospices in the area too. Our nurses are experts of palliative care. We also have several live-in caregivers available. We do anything we can to keep our seniors comfortable.
Unit 4. Medical Providers. Exercise 5. Page 11.
Green River Nursing Home Care Providers. Kim Smith, Registered Nurse, RN. John Black, Nurse Practitioner, NP. As medical professionals in geriatric medicine, they provide a lot of the medical care. They create a personal care plan for each resident and monitor each resident's health and decide if a general practitioner, GP, is needed. Sam Hubbard, Physical Therapist. He provides physical therapy to residents who are recovering from injury or illness and for those experiencing chronic pain. Tim Birch, Licensed Practical Nurse, LPN. Sarah Green, Licensed Vocational Nurse, LVN. They provide personal care and attention to the residents of our nursing home. They are in contact with residents on a daily basis. Jane Brown, Certified Nursing Assistant, CNA. Assists the nurses and helps residents with daily tasks such as eating, washing, and dressing.
Unit 5. Goals of Elder Care. Exercise 5, page 13.
Golden Years Retirement Home. Mission Statement. The quality of life of our residents is very important. We believe that good health comes from more than medical care. That's why we assist our residents in all areas of life. Everyone wants to have a social outlet. To meet this need, we encourage our residents to interact with each other, and we provide activities that stimulate them. Finally, it's important for our residents to feel some independence. So, we give them the opportunity to facilitate their own events. We will make sure our involvement is never unwanted or unhelpful.
Unit 6. Housekeeping. Exercise 5, page 15.
Social Care Manual, Section 3.2, Housework. Housekeeping is part of your work as a social care provider. You are required to do chores that are painful or impossible for your client. This may include doing laundry. Offer to iron your client's clothes if he or she is unable. If your client doesn't have a dishwasher, you may need to do the dishes for them. Help your client put away the dishes afterwards. You are also required to help your client keep his or her home tidy. Sweep the floor occasionally, clear tables, clean the kitchen countertop, and wash other surfaces. This shouldn't take too much time, however. If you notice your client's home is exceptionally messy, notify your supervisor.
Unit 7. Meals. Exercise 5, page 17.
Social Care Manual, Section 3.3, Meals. Providing meals is a part of your work as a social care provider. This can also include delivering groceries. When you cook, remember to keep your seniors' health in mind. They may have dietary restrictions. Make sure you prepare food however they need it. If your senior has physical limitations, he or she may need help eating. For example, if your senior has tremors, bring weighted utensils for them to use. The extra weight helps steady your senior's hands. For seniors who can't eat on their own, bring a bib. This prevents embarrassing spills while you feed them.
Unit 8. Bathing. Exercise 5, page 19.
Section 3.4, Social Care Manual, Bathing. Helping your client take a bath is part of your social care work. Remember that your client's body is delicate. Support your clients as they enter and leave the bath. Make sure the floor doesn't get too wet. A slippery floor can be very dangerous. If your client can't leave the bed, hygiene is still important. Give him or her a sponge bath regularly. Dry your client with a towel. Help him or her change afterwards. Don't forget to check for rashes and bruises. If you notice anything unusual, contact your supervisor.
Unit 9. Transportation. Exercise 5, page 21.
Midland Social Care. Transportation Policy. Part of your social care work is providing transportation. You are required to give rides to your client. take him or her to the grocery store once a week. Also, take them to the post office as necessary. You should take your client to social events too. Basically, aid your client in going places. Help them run errands as needed. There are some rules, however. Your client must make an appointment with you first. Keep track of your gas purchases and mileage. The company will reimburse you for these. Therefore, don't take your client on your personal errands.
Unit 10. Assistive Devices 1. Exercise 5, page 23.
Weber Assistive Devices, www.weberaid.com. Products. At Weber Assistive Devices, we provide products to support you. We're best known for our hearing aids. These devices are guaranteed to amplify sound extremely well. We also have several pairs of headphones. Our dentures have a 30-year warranty. They are built to last and feel comfortable. We also offer several types of braces. Our braces use unique zipper pulls. This makes it easy to get the brace on and off. We have 2 sizes of overbed tables. Both sizes have a telescopic base. We also sell grabbers. These are a great help to people with arthritis. Get a free chair cushion with a purchase of $20 or more.
Unit 11. Assistive Devices 2. Exercise 5, page 25.
From Linda Sellers, care provider. To Mike Tone. Hello, Mike. I'm worried about your mother being home alone. Since her accident, there is a risk of her falling. This is very dangerous, especially if she's alone. I think you should get a toilet lift. You could get a toilet rail instead if you want. If possible, you should also consider buying a walk-in bath. If that's too expensive, a transfer bench works too. A shower chair is also a good idea. Bear in mind, she also has trouble lifting her right foot. One idea is to get her a foot lifter. If I were you, I'd buy a shoehorn as well. This will all reduce the chance of her falling. She needs these items to live safely in your home. Please help me keep her safe. Sincerely, Linda Sellers.
Unit 12. Traits of Caregivers. Exercise 5, page 27.
Oakwood Villa Nursing Home. Job opportunities. Caregiver. Our caregivers are assigned to work with 4 clients each. They must be kind and caring. Sometimes our new clients aren't happy, so they need someone with a positive attitude. Moreover, communication is a very important part of a caregiver's job, as they must be attentive when talking with clients. For the same reason, our caregivers need to be patient. However, this job requires much more than talking. Our caregivers provide physical care as well. Other than that, we need reliable people who are always on time. They must be respectful of their clients too. If you are a compassionate, trustworthy person, contact us. Help us care for the elderly. To apply, send a resume and cover letter to info@oakwoodvilla.com.
Unit 13. Scheduling. Exercise 5, page 29.
Social Care Manual, Section 4.1, Schedules. Some of our caregivers work full-time. Others work part-time. All of our caregivers are required to work nights 1 week a month. To make our schedule work, we need you to be flexible. If you are not on duty, be prepared to help. Keep your phone turned on. We may ask you to cover for someone. This is true even on weekends. There may be gaps in your schedule too. There are also chances to work on holidays. You will be paid extra for working these shifts. Talk to your supervisor if you are interested.
Unit 14. Pay and Benefits. Exercise 5, page 31.
Social Care Handbook, Section 4.3. Pay and Benefits. Our full-time care providers are paid a salary. Our part-time care providers are paid hourly. All care providers are rewarded for working overtime. They are paid time and a half. All care providers should record their mileage while working. They will receive reimbursement for this. Our full-time care providers have special benefits. They are given 2 weeks of vacation per year. They are also given sick time. They accrue these days throughout the year. Full-time care providers may be given a raise. This is not guaranteed, however. Only hard-working, dedicated employees will be considered. Part-time employees can apply for full-time positions. If there is an opening, they will be considered first.
Unit 15. Training. Exercise 5, page 33.
Care Provider Safety Seminar. Care providers must be trained every 3 years. In this seminar, we teach everything in 3 hours. We even handle the paperwork. Just come and participate in our seminar. Afterwards, you'll have the certifications your job requires. Here's what we'll do. We'll discuss how to do CPR. Everyone will practice the proper technique. We'll discuss various emergencies. How do you respond to different situations? We'll discuss how to identify different wounds. We'll go over burns, frostbite, and more. We'll also discuss warning signs of age-related illness, and we'll go over the standard procedure of reporting these signs.
Career Paths. Elder Care. Book 2. Unit 1. Nutrition. Exercise 5, page 5.
Elder health care. Elder nutrition. As people age, their nutrition needs change. Elders should still eat a balanced diet. However, certain nutrients become more important. Seniors need extra calcium and vitamin D. These promote bone health. They also require omega-3s to keep inflammation down. B vitamins reduce the risk of heart disease. Seniors benefit from more vitamin C and vitamin A. Their diet must include sufficient protein, carbohydrates, and healthy fats, too. Seniors are at particular risk of malnutrition. They need many nutrients, but fewer calories. The focus should be on quality food. This means limiting processed food containing high fructose corn syrup. Elders should also avoid junk food. It tends to be high in sugar, salt, and fat. Junk food can lead to obesity. This condition is a contributing factor for many diseases. Finally, seniors often have poor appetites. This is because they lose their sense of taste and smell. Research suggests foods containing zinc may help.
Unit 2. Medication. Planning and storing. Exercise 5. Page 7.
Storing and taking medication safely. Medication needs to be stored in a cool, dry environment. Warmth and humidity make capsules less effective. Store medication in its original bottle or container. Ensure containers are childproof and out of reach of children. Refill prescriptions on a monthly rather than 3-monthly basis. This is another way to make sure pills are potent. Always check the expiration date of your medication. Do not take it after it expires. Dispose of unused or expired medication properly. Take it to a local pharmacy where professionals follow specific disposal instructions. 38% of medical errors relate to medication. Anyone taking multiple drugs needs an organization system. You can use pill boxes, which come with compartments. These are divided by day or by time of day. You can also track medication with an electronic organizer. These have timers that beep when a dose is due. Another option is to keep a detailed medication log.
Unit 3. Medication. Types. Exercise 5. Page 9.
Patient medication list. Each patient must receive the following medication. Always double-check this list before administering medicine. James Bingham. Mr. Bingham is recovering from an infection. He takes 2 doses of antibiotics with breakfast and dinner. Charlotte Dresden. Mrs. Dresden takes a laxative once a day. Please note, this is a suppository. Preston Hicks. Mr. Hicks is recovering from a recent surgery. He needs to receive painkillers on a regular schedule. He also takes a nightly sedative to help him sleep. Never give Mr. Hicks grapefruit. It interacts poorly with his sedative. Gail Isles. Miss Isles takes an antidepressant each morning. Abraham Meyer. Mr. Meyer has severe allergies. He takes an antihistamine as needed. Lucia Morales. Mrs. Morales has recently been prescribed a new stimulant. Please monitor her closely for any side effects. Mike Wong. Mr. Wong takes an anti-inflammatory for his arthritis. His dose is 1 pill per day.
Unit 4. Medication. Administration. Exercise 5. Page 11.
Sunflower Nursing Home Patient Charts. Patient name, Jessica Daines. Prescription, losartan potassium. Dosage, 50 milligrams once per day in the morning. Route of administration. The medicine is in tablet form. Oral administration is appropriate. Patient name, Jessica Daines. Prescription, hemorrhoid cream. Dosage, it is to be used as needed. Route of administration, topical medication. Patient may administer on her own. Patient name, Marcus Klaus. Prescription, insulin. The client has type 1 diabetes. Dosage, 2 shots every day. Route of administration, subcutaneous, SQ, into the back of the upper arm. You may also inject the patient in the abdomen or thigh. Patient name, Marcella Endoso. Prescription, morphine. Dosage, 10 milligrams every 4 hours. Route of administration, sublingual, SL. Patient name, Hector Trufant. Prescription, codeine. Dosage, 15 milligrams every 6 hours as necessary. Route of administration, intramuscular injection, IM. Patient name, Hector Trufant. Prescription, Colace. Dosage, this over-the-counter medicine is for use as needed. Route of administration, by mouth, PO, with a full glass of water.
Unit 5. Medication. Measurements. Exercise 5, page 13.
Medication list procedures for Sunflower Nursing Home. Lopez, J. 40 milliequivalent MEQ KCI by mouth twice a day. 1 milliliter ml cubic centimeter 1 cc insulin injection via stomach after dinner. Lou, H. 2 teaspoons TSP of fish oil by mouth every afternoon. 2 sprays of albuterol inhaler on an as-needed basis. Bass, D. 1 tablespoon TBSP of cough syrup by mouth morning and evening. Take for 7 days or until cough eases. Peters, F. 2 drops GTT saline solution in left eye twice per day. 2 grams G omega-3 by mouth every morning. Mason, W. 300 milligrams mg Wellbutrin XL oral administration at breakfast. Harris, B. 500 micrograms mcg cabergoline by mouth every night before bed. Also 500 mg calcium supplement morning and evening. Edgar, E. 0.25 ounces OZ medicinal toothpaste each morning and night. Chan, A. 5 mg oxybutynin 3 times daily. Also, 528 international units IU of vitamin D each day.
Unit 6. Medication. Frequency abbreviations. Exercise 5, page 15.
Hopefirth Hospital West. Ward 7B Patient Medications. Maria Avila. Give Mrs. Avila 500 milligrams of antibiotic pills TID. These should be taken AC with water. Check whether she needs her allergy medication. It is PRN. Hester Jones. Miss Jones takes a daily calcium supplement. The pill should be taken PC. Be sure to give her a snack with it. This will ensure proper absorption. Every night she should also take her thyroid pill, QHS. Jeffrey Stoats. Mr. Stoats needs insulin injections, BID, in the morning and night. Mason Claiborne. Mr. Claiborne requires his injections frequently, QID. Monitor his heartbeat. If it is irregular, give a 25 cc injection of lidocaine, STAT. Notify the physician on call immediately. Catherine Conti. Mrs. Conti's IV drip should be exchanged QH. Louis Grover. Mr. Grover takes a double dose of cholesterol medication QOD.
Unit 7. Medication. Complications. Exercise 5, page 17.
Drug interactions represent a serious threat to seniors today. That's because polypharmacy is on the rise. The more medications you take, the more likely that they could inhibit or strengthen one another. Every new medication complicates the matter. If you start taking a new medication, watch out for side effects. For example, you may feel drowsy or experience dizziness. We recommend you avoid driving until you know how medications affect you. Many times, these side effects are normal or expected. However, if you progress from feeling lightheaded to feeling disoriented, you should consult your doctor. Lastly, be mindful of your dosages. Some medications are more harmful than others when taken incorrectly. A single accidental overdose can be fatal. Double-check the dose and frequency instructions with new medications.
Unit 8. First Aid. Exercise 5, page 19.
Basic first aid. In a medical emergency, always call for assistance. While you wait, perform basic first aid. Assess the victim's condition. Give him or her plenty of space. If the victim is bleeding, cover the wound. Then apply direct pressure to lacerations. Elevate the injured area until it is above the heart. When the bleeding stops, put on a bandage. Treat burns with lots of cool running water. Then cover the burn. Watch victims for signs of shock. Monitor their body temperature. Be aware that shock victims may faint. If the legs are uninjured, lift them about 12 inches. Do not provide food or water. Bone, muscle, and joint injuries are hard to assess. Rest the injured area. Apply ice to reduce pain and swelling. Encourage the victim to stay still. Accident scenes can be hazardous. If the location is unsafe, move the victim. However, first immobilize the injured body part. Above all, keep yourself safe.
Unit 9. CPR and the elderly. Exercise 5, page 21.
First responders. When the elder in your care collapses. If you see an unconscious person, follow these steps after checking the scene and calling for an ambulance. 1. Check the person's pulse, either on the wrist or the neck. 2. Check the airway for potential obstructions. Keep the airway clear. 3. Know the pulse before administering medical attention. 4. If the pulse allows it, perform CPR. This includes chest compressions and rescue breathing. 5. First, press down on the chest directly above the sternum. 6. The compressions must be firm. You may crack the sternum or rib, but this is sometimes unavoidable. 7. After compressions, perform rescue breathing. Tilt up the victim's chin to clear the airway. For your personal safety, use a face mask or mouth guard. 8. Repeat CPR cycle until help arrives. Old bones are softer and weaker. Damage to the bone can be serious and painful. The cracked rib can puncture a lung and cause serious respiratory issues. It is sometimes good to just wait for medical professionals to arrive. A defibrillator is more effective than CPR.
Unit 10. Incontinence. Exercise 5, page 23.
Always treat your patients with respect. Not everything about aging is particularly graceful. Several of my patients suffer from incontinence or otherwise need help getting to the bathroom. This is a potentially embarrassing situation. Wearing adult briefs, or sometimes even incontinence underwear, can be a humbling situation. As the care provider, you should be sensitive to your patients' feelings. Patients must always be treated with dignity. One of my patients is often unaware when she is about to have a bowel movement. She doesn't have very good bladder control. She used to have accidents very frequently. I can tell that she is embarrassed, especially when I am changing her adult briefs. It's easy to feel defenseless and useless. She would use sanitary napkins in the past, but they're not appropriate anymore. She may be switching to a bedpan soon. This is because she is having more difficulty moving. My job isn't just to provide it. I have to be professional and discreet. The inability to use the bathroom can be humiliating, but doesn't have to be.
Unit 11. Mobility. Exercise 5, page 25.
Life is difficult when you're unable to get around. You often have to rely on other people to perform simple tasks. It can limit all of your daily activities. Thanks for visiting us at Fredson Family Mobility Services. We can help you get back the mobility and freedom of your youth. We offer affordable but effective mobility equipment. A cane is minimally supportive and is great for very active customers. A walker or roller offers great support with very little maintenance. A Fredson family wheelchair can be either rented or purchased. We can install a stair lift into your home. So, having to climb a staircase doesn't have to be a chore. The stair lift makes the task as simple as clicking a button. Public transportation can often be tricky and bothersome for those with limited mobility. Fredson Family has just begun offering a tailored shuttle service between popular destinations. These include grocery stores, libraries, and pharmacies. This service comes at a moderate fee.
Unit 12. Fall prevention. Exercise 5, page 27.
Getting around. Some quick tips on preventing falls. The average residence can be an accident waiting to happen. You can trip over a rug or stair, fall, and cause serious damage. It can severely impact your mobility. In order to avoid the risk of serious injury, take simple steps to make your home risk-free. Make sure your house has good lighting. This makes it easy to see and avoid any obstructions that can cause injury. Do whatever you can to make walking around your home easy. This includes using walking aids like canes and walkers. In addition, you can install a handrail in central locations, such as stairwells and bathrooms. Adding non-slip rugs and mats to slippery linoleum floors can also prevent stumbling. Make sure to clear a path through all rooms. Remove all unnecessary clutter to keep spaces open. A household pet can also be a hazard. Fit large mobile pets with bell collars. This way you can always know where they are.
Unit 13. Common injuries. Exercise 5, page 29.
Grisham Gazette Weekly. Local News. Page A7. Grisham Community Elderly in Danger. After last week's heat wave, the hospital received an influx in emergency visits. Many of these patients were elderly,
We've never seen heat like this.
a nurse said today.
Most people don't know how to adapt.
Temperatures in Grisham are typically moderate. Many homes don't have proper air conditioning. This is especially problematic among the elderly who live alone. Residents fainted with the heat. Many of these falls led to broken bones. The hospital also had to tend sprains and fractures. There were 7 severe cases of heat stroke. All of these victims were over 75. This mirrors a problem the hospital experienced last winter. Last January, there were 13 cases of severe hypothermia among the elderly. As can be seen, the elderly in general get injured more easily. In fact, throughout the year, the hospital treats the elderly the most for common injuries. These include anything from treating a sprain to a bruise. It also takes longer for them to recuperate from injury. Even cuts take longer to heal.
Unit 14. Wound Care. Exercise 5, page 31.
Caring for wounds. Staff members will regularly dress and examine your wounds. However, you can help by closely monitoring your injury. Watch for signs of the following conditions. Necrosis. Necrosis is a cell injury that results in tissue death. It is vital to discover the cause of necrosis. This condition needs rapid treatment. This involves debridement, where dead tissue is removed. Warning signs for necrosis include scars. Also be alert for sloughs of dead tissue. Maceration or desiccation. Healing skin should not be too wet or too dry. An indicator of maceration is unusually soft and white skin. This means the skin is being kept constantly wet. For desiccation, watch for skin that is dried out. This may result in cracking and bleeding. Cellulitis. Cellulitis is the inflammation of connective tissue and skin. It frequently occurs around sutures. Cellulitis may involve an exudate that must be drained.
Unit 15. Medical Equipment. Exercise 5, page 33.
From manager@zhnursinghome.com to director@zhnursinghome.com. Subject: Medical Equipment. Jack, I recently took an inventory of our equipment. The nursing home needs to order or replace multiple items. We need 2 new alternating pressure mattresses. Some of our current ones are in poor condition. These need to be replaced urgently. Several residents use oxygen tanks. We need to order the appropriate tubing. I suggest we order latex gloves in larger quantities. We already buy in bulk. However, we go through those very quickly. We need to order more syringes. It would be helpful to have 3 more sharps containers. The staff also requests 2 additional biohazard waste containers. Finally, the nursing home is running low on medical clothing. Specifically, we do not have enough masks and gowns. This is only a summary. I attach the full inventory for your attention. Please get in touch if you have any questions. Best, Paula.
Career Paths. Elder Care. Book 3. Unit 1. Legal Concerns. Exercise 5, page 5.
To roberts@mail.com. From Tom Smith at lawgroup.com. Subject: Estate Planning. Dear Mr. and Mrs. Roberts, I am glad I had the opportunity to meet you both yesterday. I am pleased to serve as your lawyer, and I aim to make the estate planning process as straightforward as possible. Before our next appointment, please discuss your wishes for medical intervention and end-of-life care. We will talk about DNR orders and advance directives at our next meeting. You expressed concern about what might happen if one or both of you were to become incapacitated. As I mentioned in our meeting, a power of attorney can be an invaluable legal tool in such a situation. As per your request, I will prepare some forms and documents to help with the power of attorney creation process. This will be ready for your review during our next meeting. I will look over the rough draft of the will you gave me, as well as your financial documents. At our next appointment, we will discuss the will and your options for placing your money in a trust. In the meantime, think about which persons you wish to name as beneficiaries. I look forward to seeing you both again in 2 weeks' time. Feel free to call my office if you have any questions. Sincerely, Tom Smith.
Unit 2. Client Journal. Exercise 5, page 7.
Employee Handbook. Section 14. Client Journal. The Client Journal is a helpful tool that keeps everyone updated on an individual client's progress. By reading the daily entries, you will have a better understanding of the client's situation. Therefore, we recommend that you review the most recent entries before the start of each shift. The entries will bring you up to date on the client's recent activities and inform you of important developments. With this information, you will be better prepared to provide the utmost in service and care. You will update the client journal immediately after each shift. Note your observations about the client and record any sudden or unexpected events. This way, other employees that work with the client will be informed of these developments. To avoid confusion, make sure you include the time and date of your shift at the beginning of each entry. The client journal may be in either a notebook or binder format. If using a binder, make sure that the entries are well organized. If you remove a page from the binder for whatever reason, put it back in its appropriate place. If using a notebook, make sure that each entry starts on a new page. This makes it easier to locate a particular past entry.
Unit 3. Elder Abuse. Exercise 5, page 9.
Recognizing elder abuse. Elder abuse occurs when a caregiver mistreats an elderly individual in his or her care. It can take a number of different forms. For example, we consider any action that harms a person's body to be physical abuse. While physical abuse is often the most recognizable form of elder abuse, verbal abuse is also a serious issue. If a caregiver uses words to insult, demean, or threaten an individual, he or she abuses the individual verbally. Negligence occurs if a caregiver fails to provide an individual with the proper or necessary level of care. If a caregiver neglects a bedridden patient, the patient may develop painful bed sores. Additionally, an individual who takes advantage of a client's physical, cognitive, or emotional weaknesses also commits elder abuse. This caretaker may commit theft or engage in other criminal or inappropriate activities. There are also some less obvious forms of elder abuse. For example, a caregiver may belittle an individual or treat him or her in a disrespectful manner. A caregiver may do this by using elder speak, an overly simplified way of speaking that is condescending to the patient. If you suspect a case of elder abuse in any of these forms, report your concerns to the proper authorities immediately.
Unit 4. Communicating with patients and family. Exercise 5, page 11.
Senior Care Professionals Handbook, Chapter 5. Communicating with clients and family. Senior care professionals communicate with clients and their family members on a daily basis. Therefore, good communication skills are of utmost importance in providing quality care. When speaking with clients and their family members, try and establish good rapport. Ask open-ended questions rather than questions that people can answer with a simple yes or no answer. This allows people to share their feelings, an action that is therapeutic for many individuals. Use your listening skills and nonverbal communication skills to convey your feelings of empathy for individuals. Health literacy, or the ability to understand and make decisions about health-related information, varies among individuals. Therefore, avoid using excessive amounts of healthcare jargon. This increases anxiety in people who are unfamiliar with the terms and who are already under emotional stress. It may even lead to instances of miscommunication, which are stressful for everyone involved. To prevent these situations, use good verbal communication to explain concepts clearly and accurately. Finally, do not let any preconceptions about individuals affect the quality of care you provide. In a multicultural society, cultural differences among staff, patients, and family members are common. Make sure that you treat all patients and family members you encounter equally and with respect.
Unit 5. Communicating with staff. Exercise 5, page 13.
Memo. To care providers. From management. We have recently become aware of some problems with communication among the care providers. These instances of miscommunication place our clients at risk. Therefore, we'd like to take this opportunity to highlight the importance of proper communication within our departments. In addition, we'd like to remind you of the proper procedures when administering care. First of all, make sure you adhere to the individualized plan of care assigned to each client. Doctors prepare these plans after a period of careful assessment and client monitoring. Therefore, you must follow the plans of care as closely as possible. Secondly, if you need to document something in a client's plan of care, do so legibly. Make sure that the note is comprehensive. However, keep it concise. Do not include more information than is necessary. We require our care professionals to update each other on each client's status. When writing these updates, make sure that you only use abbreviations that other care providers will easily understand. Your coworkers should not have to guess what you meant. Additionally, be sure to write updates legibly and keep them in chronological order for easy reference. Let your manager know if you have any questions about these guidelines or procedures.
Unit 6. Emotional Health. Exercise 5, page 15.
Guide to Mental Health for Elder Care Providers. Section 4. Depression. Care providers who work with elderly individuals should be familiar with common mental health problems. One of the more prevalent mental health problems among seniors is depression. It is important that their care providers understand this serious condition and be able to identify its warning signs. Some individuals suffering from depression will have a pessimistic view of their current situation and of their future. Other individuals will demonstrate apathy, where they seem disinterested in events and activities they once enjoyed. Another common effect of depression is that the individual becomes withdrawn or emotionally distant. In serious cases, an individual may become unresponsive to care providers, their family members, and their friends. In the same way, feelings of hopelessness and despair characterize the mental state that accompanies depression. These feelings may be so intense that they lead the individual to contemplate or attempt suicide. Therefore, it is important that you pay close attention to the moods your clients are experiencing. If you notice a decline in a client's emotional well-being, treat the situation seriously. Connect the patient with the mental health professionals that are best equipped to help treat depression. Timely intervention is invaluable. Your assistance can help the patient recover and enjoy life once again.
Unit 7. Common Diseases 1. Exercise 5, page 17.
Patient files. Notes for care providers. Patient name, Leo Smith, age 77. Health information. This patient has arthritis of the knees, which causes pain and limits his mobility. He also has arthritis in the joints of his hands to a more limited degree. In addition, he has some hearing loss, which he corrects with a hearing aid. Patient name, Mary Miller, age 87. Health information. This patient has several serious ailments. They include glaucoma and cataracts, which have caused some loss of eyesight, particularly in her left eye. She also has emphysema, which leaves her with a chronic cough. Her emphysema makes her more prone to infections such as pneumonia, so treat even minor colds and illnesses seriously. Since she has osteoporosis as well, take special precautions to help her avoid falls. A fall a few months ago resulted in a broken hip, from which she is still recovering. Patient name, Joe Ayers, age 75. Health information. This patient has hypertension, which places him at increased risk of a heart attack or stroke. He suffers from insomnia, which causes him to feel tired much of the time. To help with his insomnia, he takes medicine nightly to help him fall asleep.
Unit 8. Common Diseases 2. Exercise 5, page 19.
Handbook for Care Providers, Chapter 8. Unexpected Changes in a Patient's Health. There are several serious acute conditions that commonly affect elderly individuals. As a care provider, you should be knowledgeable about these conditions and their symptoms. Two particularly serious health events are heart attacks and strokes. A blockage of blood flow to part of the heart causes a heart attack. Some of the most common symptoms of this condition are chest pain and shortness of breath. If you believe that a client is having a heart attack, call for an ambulance immediately. The cause of a stroke is a blockage of blood flow to part of the brain, and its onset is very sudden. The client may report that parts of their body feel numb. Half of the individual's face may droop, and he or she may slur their words when speaking. The individual may appear confused. If you suspect that a client has had a stroke, get him or her to a hospital as soon as possible. In an elderly individual, a cold or the flu can quickly become a more serious health problem, such as pneumonia. Pneumonia, a condition in which a person's lungs become filled with fluid, can be life-threatening. Therefore, keep a watch for sudden high fevers or a worsening of the symptoms of an infection.
Unit 9. Common Diseases 3. Exercise 5, page 21.
The Journal for Health Professionals. Volume 6, Issue 2. Diseases that affect cognitive functioning. Care providers must be well equipped to help patients with a wide variety of debilitating conditions, including cancer, heart disease, and diabetes. In addition to these conditions, care providers should also have a strong understanding of diseases that affect cognitive functioning. This knowledge is particularly important for those who work with elderly individuals. This is because diseases that impair mental abilities become more common with advancing age. Caring for elderly individuals who have symptoms of dementia presents unique challenges. Individuals with dementia may frequently appear disoriented or confused about their surroundings. They also experience difficulty remembering information or recalling past events. This memory loss is a main symptom of Alzheimer's, a common disease among elderly populations. The mental impairments caused by Alzheimer's greatly affect the patient's quality of life, as well as their friends and family. Some patients with Parkinson's disease, a disease that affects the central nervous system, will also exhibit symptoms of dementia. As Parkinson's is a progressive disease, the tremors and motor problems the disease causes will gradually increase in their severity. Care providers for these individuals must be patient and highly understanding of the challenges these individuals face.
Unit 10. Monitoring Equipment. Exercise 5, page 23.
Our products. eldercareinc.com/products. We offer a variety of useful products that help you provide timely and compassionate care for older clients, friends, or family members. Please review the information below and feel free to contact customer service with any questions. Door alarm. It can be worrying when an elderly client or family member wanders the streets. This device alerts you when a door is opened, letting you know that the individual is trying to leave. Bed alarm. If you are concerned about an older person getting out of bed in the middle of the night, this is a helpful product. It senses pressure when the individual steps out of bed and onto the mat. Bed wetting alarm. This moisture sensing device notifies you when the individual wets the bed. It helps you change the sheets and clean the individual right after the accident occurs. Video monitor and camera. Set up these devices so that you can monitor the individual, even while in a different room or part of the building. Medical bracelet. If a person in your care gets lost, this bracelet will help them get back home. It has GPS capabilities, which allows you to track the person and pinpoint their exact location. It also lists important health information.
Unit 11. Testing Devices. Exercise 5, page 25.
Medical Equipment Journal, Issue 7. The Role of Point-of-Care Devices. In the past, healthcare professionals could only perform high-tech patient assessments in well-equipped medical facilities. Today, thanks to continued development of point-of-care testing devices, many common assessments can take place anywhere. Many of these devices are MEMS, or devices that contain both mechanical and electrical components. Others, called BioMEMS, combine microelectromechanical technology with biosensors. BioMEMS let healthcare professionals evaluate tissue samples even while far away from a medical laboratory. Some devices utilize microfluidics technology to move small amounts of fluid through miniature tubes. Most labs on a chip, or devices that combine several related laboratory tasks onto a single chip, use this technology. Point-of-care devices serve a wide variety of purposes. For example, health professionals can use portable oximeters to evaluate levels of oxygen saturation in patients. Portable spectrophotometers, as well as equipment for performing ECGs and EEGs in home care settings, are also available. An additional advantage of many point-of-care devices is that patients can learn how to use them. This allows patients to take a more active role in monitoring their health. For example, individuals with diabetes can use portable glucose monitors. These devices allow them to easily and inexpensively evaluate their current blood sugar levels.
Unit 12. Preventing infection. Exercise 5. Page 27.
Staff Manual, Section 5. Preventing infections. All hospital staff must take certain precautions to prevent nosocomial infections. These are infections that a patient acquires during their stay in a hospital facility. Contact with other individuals, contaminated equipment, or airborne particles can transmit bacteria or viruses to patients. Once parasitic organisms enter a person's body, they can cause serious infections. This is particularly true in patients whose immune systems are already compromised. Following these guidelines will not only help keep patients safe, but you and other staff members safe as well. One of the most important ways of preventing infections is hand washing. Make sure you wash your hands thoroughly both before and after patient contact. In addition, clean patient areas frequently with antimicrobial products and disinfectant. Cleaning ventilator equipment is particularly important in preventing ventilator-associated pneumonia. Additionally, be sure to dispose of biohazardous waste properly. We consider all materials that may contain bacteria, viruses, or biologically derived toxins to be biohazards. We quarantine patients that have highly contagious infections or ones that exhibit antibiotic resistance. Make sure you wear a face mask at all times when in the quarantine area. This is for your own protection as well as the protection of others you may come in contact with.
Unit 13. Funeral planning. Exercise 5. Page 29.
The importance of good funeral planning. While not always an easy topic of discussion, funeral planning is very important. Not only does it establish your funeral and burial preferences, but it makes the process easier for your loved ones when that day arrives. Your friends and family will appreciate any help that you give them ahead of time. First of all, determine your burial preferences. If you wish to be buried in a cemetery, strongly consider reserving a plot. You can also select and prepay for a casket. These actions will allow your loved ones to focus on supporting each other after your passing, rather than meeting the financial demands of a funeral. If you prefer cremation to a traditional burial, indicate this during your funeral planning activities. We recommend prepaying for an urn and the cremation process. Let your family know if you have any special wishes in regards to your cremated remains. The process of planning a wake or a viewing can feel overwhelming for friends and family. Selecting pallbearers, writing eulogies, and choosing readings for the funeral ceremony can be a difficult task as well. Letting your loved ones know your preferences will alleviate much of the stress associated with planning these events.
Unit 14. Challenges. Exercise 5. Page 31.
Caregiver's Central Message Board. Struggling to cope. Care Pro 77.
I've been really struggling recently with the challenges of caring for my elderly patients. I feel overwhelmed every day at work because there is just too much to do. In addition to the physical exhaustion I'm feeling, I'm also struggling to cope with the emotional demands of the job. I get attached to my patients and mourn them when they pass away. I'm afraid I'm going to burn out soon.
MedHelper 23. There are so many aspects of our jobs that are challenging. For example, I struggle with helping family members make the decision to place a loved one in a home. I also feel grief when patients pass away. I've found that a short break can put things in perspective. You might consider asking for some time off.
Care Lady 12.
If you find your job so difficult that it affects your health, it might be time to move on. I've also experienced confusion and frustration while on the job. It was only when I made a career switch to a less stressful caretaking job that I began to feel better.
Care Pro 77.
Thanks for the good advice, both of you. I have some things to think about. I'll keep you posted.
Unit 15. Future of the Industry. Exercise 5, page 33.
Healthcare Weekly Magazine. The Growing Need for Elder Caregivers by Linda Thomas. The demand for caregivers increased dramatically in recent years. Thanks to advances in healthcare technology, people are living longer and longer. As a result of these increased lifespans, the elderly population is larger than ever. Since many of these individuals require assistance due to health or mobility problems, the need for care providers is high. Many elderly individuals currently rely on caregivers for eating, bathing, and dressing. However, in addition to these basic needs, caregivers also provide their clients with social interaction and emotional support. Today, many older individuals strive to live active, independent lives. As a result, the role of the caregiver has changed and expanded. Elder care is a good career field for the right type of person. The most successful care providers tend to be patient, compassionate, and good communicators. For those that can handle the job, there are abundant care provider job openings. Employment professionals expect that growth in the elder care industry will continue in the coming decades. With so many job opportunities, the outlook for the industry looks very bright. Hospitals, nursing facilities, and home care agencies will continue to need talented care professionals for years to come.
AVN Pharma Education.